Hello, everyone. So thank you so much for joining today for the Colorado Cancer Coalition discussion on COVID-19. We're very excited to have Dr. Chris Liu from the University of Colorado Cancer Center, who is the director of the GI Medical Oncology Group. And so Chris is a longtime colleague and friend of many of us in the coalition. And so we thank Dr. Liu for his expertise and his time as we really examine and unpack what's going on with COVID-19 specific to the cancer community. And I think Chris has done a nice job of doing a disclaimer that he is not an ID doc, but of course is someone who's a great practitioner, sound mind, and someone who does great things for a lot of people in terms of delivery of care. We know that Chris has a great message to convey. So on behalf of the Cancer Coalition, Christy Cahill and our team, we just want to say thank you to everyone. I know the University of Colorado, the American Cancer Society, National Jewish Health, our health department and others have been instrumental in thinking about key messaging and programming. So thanks for everyone for joining in today and for all of those who've helped support, and Chris for being so facile to have this discussion today. So Christy Cahill, before I turn it over to Dr. Liu, anything particular that we need to cover today? Anything?
Yeah, just logistically, if anybody has a question, they can post it in the Q&A section in your settings. You should see Q&A. So please put it there and we'll try to get to it today. And if not, we can follow up later with the answers.
Okay, excellent. And a huge thank you to Elsa Wellstein for also the great support and always being so fantastic in terms of making sure that we pull these things off. So Dr. Liu, I'm going to go ahead and turn it over to you this morning to further introduce and for us to get started. And just a quick logistics to Christy's point, Dr. Liu will present, we will entertain questions, and then Christy will be sharing a bit about some of the resources that are available to cancer patients during the flu season and this COVID-19 issue that we're facing. So Dr. Liu, we'll turn it over to you.
Thanks so much, Andy, and thanks, Christy, and to the Colorado Cancer Coalition for putting together this update on COVID-19. And again, just like Andy said, I'm not an infectious disease expert by any stretch of the imagination, but certainly a practicing oncologist, and I really want to talk about how this has impacted, obviously, our patients and our hospital system, our country, and indeed the world as well. So thank you for taking the time to join. Over the next 20 minutes, this is what we want to cover. And I will tell you that a lot of the information that I'm going to talk about has already been really blasted out by news sources and physicians and certainly your friends and your neighbors as well. And this also is changing literally hour to hour in some instances. And so I'll talk about the data as it currently is, knowing full well that this could certainly change over the next couple of days as well. But we want to talk about how cases of COVID-19 present, and so what are the presenting symptoms when patient is diagnosed with this disease. We want to talk about the nationwide and worldwide impact of COVID-19. I want to spend most of my time on warning signs and what to do if you're sick, particularly if you are a patient that has a diagnosis either currently or in the past of cancer, and obviously want to talk about prevention as the most important thing that we can think about right now. All right, so describing COVID-19. So what is it? COVID-19 is a form of coronavirus, and coronavirus, we learn in medical school is just the virus that causes the common cold. But a different version of coronavirus really emerged in Wuhan, which is a city in China, in December of 2019. And so the early hypotheses were that this disease came from a seafood market in Wuhan, China, but there's still a lot of investigation into this. But what people were noticing were that people that have visited the market started developing a viral pneumonia, and in some cases was very, very severe and potentially deadly. And certainly, as time goes on, we'll learn more about how this virus originated and spread, which will also be important in terms of treating it as well. So how do patients present? And so one of the things that's really interesting is the amount of data and knowledge that has really come about very, very quickly in a very short amount of time. And so this was an article published in the New England Journal of Medicine very recently describing the clinical characteristics of patients that were diagnosed with this disease. So median age, or so the average age roughly, was around 51 years. And 23 to 50% had greater than or equal to one comorbidity. And what a comorbidity is essentially another disease. So something like coronary artery disease, diabetes, or even cancer. The presenting symptoms have ranges, and so roughly 77 to 99% presented with with some fever, or at least a history of fever. But interestingly, less than half of the patients actually had a fever when they presented to a healthcare provider. Cough is a very common symptom with this disease syndrome, 48 to 82%. Muscle aches, or what we call myalgias, present in a decent amount of patients. Interestingly, there are two very important points here. Having nasal congestion or rhinorrhea, which basically means a runny nose, that's pretty uncommon in terms of the presenting symptoms, and a sore throat present in a very kind of small group of patients. And so what's interesting about these presenting symptoms is that they do mimic the flu in a lot of ways, but they do not mimic kind of your common cold or even allergies that patients have, especially this time of year. But one of the most important things is that a little bit over half of the patients develop shortness of breath about 8 days after onset. And so what most people believe is that after you've been exposed, you start developing these symptoms somewhere between 7 and 14 days after you've been exposed to the disease. And so that's why when people talk about self-quarantining, they talk about 14 days as the length of time, because if you're going to develop these symptoms, it's usually going to be within 1 to 2 weeks. Everybody knows on the call that Italy has been very, very hard hit by COVID-19, and so these graphs and charts describe the number of cases, and obviously these numbers are now out of date because it's a couple of days old, but it kind of gives you an idea of the impact that this disease has had on Italy. You see here the cases by age range, how many men and women were affected, and how many cases were severe. And so there are several take-home points from this slide. One is that although we worry about the impact in our elderly population, you can see that the age range of these cases really kind of span the entire age range, really from 19 all the way to past 70. You can also see that for a majority of the people that contract this disease, the syndrome is still fairly mild. And so for most of the cases that are happening even in Italy, patients are getting sick, but they're not requiring hospitalizations. But the issue, obviously, is that a quarter of the patients that develop the disease are requiring significant hospital support. The other take-home message here is that there's a good news and a bad news. Obviously, the good news is that the younger population appears to be not as impacted as the older population, but of course the bad news on this graph or on this chart is that the older population are really adversely impacted at a much higher rate. Now, it's not that everybody over the age of 70 is going to require hospitalization, but it does seem like a greater percentage of patients in that age range are requiring more support than the younger population. So what about the worldwide impact? So this is the most updated map of coronavirus in the world from Johns Hopkins University. So as of this morning, 350,000 plus patients diagnosed with COVID-19 with over 15,000 deaths. But of course, the good news on this graph is the 100,000 that have recovered. Now, the issue with this graph, and I think that everybody knows on the call, is that to diagnose a disease, you actually have to be able to test for it. And so everybody assumes that this number is significantly higher than 350,000. But these are the confirmed cases, and obviously people are recovering. Interestingly, when you look at the graph on the right, you can see kind of a steady increase in the number of cases, but then really in March has taken off very, very quickly. And we'll talk about what exponential growth really does mean later on in the talk. How is this virus impacting the state of Colorado? As of this morning, there are 595 confirmed cases. There have been really, unfortunately, already 7 deaths. But you can kind of see from this graph where the cases are kind of springing up, and they're more or less all over the state, but certainly impacting Denver and Eagle County kind of as the highest confirmed cases by county. This graph shows you the trajectory of coronavirus cases over time. And this, you can kind of see that Iran, Italy, and South Korea had a significant number of cases. I think the concerning thing here is that the U.S. is tracking a lot more like Italy than it is necessarily like Japan, Singapore, and Hong Kong. And I think the key here is that when you look at the number of cases in Singapore and Hong Kong, you really do see the power of very, very strict prevention. And obviously, there's some things that can be done in Singapore that just are not possible to be done here in the United States, but you can see the impact of having strict quarantine rules and rapid action in terms of preventing the disease. So, a lot of data I think a lot of people are very aware about, but, what should we do if we're sick, and what are some of the emergency signs that we should be looking for? And I'll talk specifically about cancer towards the end of this section, but what to do if you're feeling sick. I put up here on the next two slides on the top right-hand corner the Colorado call line for COVID-19. And so there's an email address there, there's a toll-free number, and then a 303 number. And certainly this is really a good place to start in terms of where to get some answers, particularly if you are feeling ill. But now that you know more about the way the clinical syndrome it presents or exhibits, the key here is to understand that even if you're diagnosed with COVID-19 or coronavirus, that for a vast majority of people, you'll feel sick and then you will recover. And so just because you may have coronavirus or COVID-19, it does not mean that you need to seek care at a medical facility, mainly because the intervention is to take good care of yourself. And so you should stay home except to get medical care. Within your own house, you should separate yourself from other people in your home, which means home isolation. We definitely want everybody to call ahead before visiting your doctor. Number one, to determine if you do need medical care, but number two, because if you do have the virus or really even any other virus, we don't want to expose other patients, potentially with other diseases that they have, such as cancer, or staff being exposed to coronavirus unless absolutely necessary. We'll talk a little bit more about face masks in a bit, but you should wear a face mask if you are sick, and then certainly cover your coughs and your sneezes. We'll talk a little bit more about cleaning your hands, but you do need to wash your hands very often if you're sick to avoid transmitting the disease to other people. This is kind of an interesting thing, but we realize now that this particular version of coronavirus really does last fairly long on surfaces. And so we want people to avoid sharing personal household items. We want people to clean all high-touch surfaces every day. When we think about high-touch surfaces, we normally don't think about things like doors and doorknobs and locks and, if you're in a building, elevator buttons. But certainly if you're sick, you want to clean all these high-touch surfaces every day. You want to be able to monitor your symptoms. And I will tell you that many institutions have currently discontinued testing for people who are not requiring hospitalization. And so unless you're severely sick, there's a good chance that you won't be given testing, not because people don't want to test, but simply because there's a current shortage of tests. And so we simply cannot test everybody that has some of these coronavirus symptoms. So when can you discontinue home isolation if you exhibited symptoms like fever or cough? If you haven't had testing, and this will apply to a majority of our people here in Colorado, you can leave home after these three things have happened. You can't have had a fever for at least 72 hours, so that's 3 days of no fever without the use of any medicine that reduces fevers, and good examples of that would be Tylenol and ibuprofen. And other symptoms have improved. For example, if you have a cough or any shortness of breath, those need to be improved. And in addition to those two, at least 7 days have passed since your symptoms first appeared. So that's when you can discontinue home isolation. I did put, if you have been tested and you've tested positive for COVID-19, you can leave home after you obviously no longer have a fever, without the use of medicine that reduces fevers, and your symptoms have improved, and you need to have received 2 negative tests in a row 24 hours apart, and your doctor who is following that testing will follow the CDC guidelines. When should you seek emergent medical care? So these are some of the symptoms, but they're not all inclusive. But if you have these symptoms, we really do want you to be seen so that we can act and certainly work to get you feeling better. But if you have difficulty breathing or shortness of breath, those are definitely indications to seek medical care. if you have persistent pain or pressure in your chest, if obviously you have new confusion or an inability to arouse, you feel very, very sleepy, or your family members are noticing this, you need to. And then bluish lips on or bluish face is really indicative that you're not getting enough oxygen. So that's definitely emergency warning signs. This list is definitely not inclusive, and certainly feel free to call either the helpline that we put on the other slides or your medical provider if you have any of these symptoms or other symptoms that you find concerning. All right, prevention. So this graph shows you two things. One is the effect of social distancing on the 1918 Spanish flu. And so when the flu epidemic or pandemic occurred in 1918, it infected roughly 500 million people and caused the death of 50 million people, and is really an example of how bad a pandemic can get, particularly in an era where there wasn't very much medical support. But we want to show you the difference between Philadelphia and St. Louis. So the first case was identified in Philadelphia September 17, 1918, and then social distancing interventions were first enacted roughly 2 weeks later, October 3rd, and it's actually not that long amount of time, but you can see the impact on the number of deaths per 100,000 people in Philadelphia compared to St. Louis. So the first case in St. Louis was identified on October 5th, and social distancing was enacted literally 2 days later. And you can see how different the two curves looked by city simply by enacting social distancing rules essentially 10 or 12 days earlier. And what we mean by this is something that you have all heard, and that is flattening the curve. And as you can see, Philadelphia mimics the curve that you see on the left, and St. Louis mimics the curve that you see on the right. And the idea being that if you can prevent the number of cases from spiking in a short amount of time, you don't overwhelm the healthcare system. And certainly there are a limited number of beds, there are a limited number of ICUs, there are a limited number of ventilators. But if we're able to flatten the curve in this way, the healthcare system can take care of those that are sick and get them recovered, as opposed to being totally overwhelmed which is what we're seeing in Italy. And I do want to talk a little bit about what's happening in northern Italy and this idea of exponential growth. And you kind of talk about the way I kind of describe this is that if you tell one person a rumor, very oftentimes that one person doesn't tell just another one person a rumor, and then that person tells only one person a rumor. What happens is if you tell one person a rumor, that person is likely to tell 5 people, and then those 5 people are likely to tell 5 people that they know, and so on and so forth. And what that really contributes to is what we call exponential growth, where instead of a straight line, you're seeing these curves that kind of start slow and then all of a sudden just explode, which is exactly what we're seeing in Italy. And you can kind of see that really kind of the social distancing regulation came into play about 2 to 3 weeks after the first case. And what that ended up happening was exactly what we talk about in terms of not flattening the curve. You had, a dramatic increase in cases. You had hospitals turning ORs into ICUs. You had 1 in 10 providers infected with the disease itself. You had people working way outside of the realm of their specialty with orthopedics and urology managing ICU cases. And certainly Italy's response to this has obviously been to really tamp down on social interaction and expanding social distancing, but they're also bringing doctors out of retirement and accelerating the graduation for healthcare providers, and really is in stark contrast to what we saw in Japan, Hong Kong, and Singapore, where they've had a significant impact on limiting this disease. So what can we do for prevention? You guys have heard this kind of more often than you probably want to, but certainly washing your hands is really the biggest thing to prevent this disease. They talk about washing with soap and water for at least 20 seconds, and I can tell you that that is not a very natural thing to wash your hands for that long. There's different strategies to be able to do this, whether it's singing happy birthday 2 times in a row or singing your ABCs, but certainly understand that you do need to wash your hands longer than you probably normally ever have in your lifetime. If soap and water are not available, using hand sanitizer certainly will work. To the extent possible, avoid touching high-touch surfaces in public places. So this means elevator buttons, door handles, handrails. Obviously, we don't want people shaking hands or even high-fiving each other anymore. And if you do have to touch something, you can use a tissue or your sleeve to cover your hand. People know to avoid touching your face if at all possible, but this is something that everybody does more or less every single day of their lives. And so certainly try to avoid touching your face. Clean and disinfect your home to remove germs. This includes tables, doorknobs, light switches, you name it. Avoid crowds. This has really been enacted within Colorado to avoid just exposure to the virus. And then non-essential travel has really gone down across the entire country, but especially now we recommend avoiding any travel if at all possible. All right. So I want to spend a lot of time here talking about patients with cancer. And so if you have had a diagnosis of cancer or you're currently receiving therapy, we do want you to continue receiving treatment as planned unless notified otherwise by your care team. Many of the patients that are diagnosed with cancer who are receiving treatment are receiving that treatment either because they're trying to cure their cancer or at least trying to maintain their cancer from growing or spreading. And so here we talk about risks and benefits. And if you're currently receiving therapy, the guidance right now is to continue treatment as planned unless otherwise notified. But we do want you to have an honest conversation about your doctor about the benefits and the risks of continuing treatment. And this is a conversation that I've had with now hundreds of my patients. I really don't mind having these conversations because each individual is unique. And sometimes we've talked about maybe delaying treatment or reducing treatment. But for the most part, we're continuing treatment as planned, particularly if our patients are receiving benefit. If you're currently in surveillance, and so what that means is that you're looking for cancer, but you're not actively treating cancer. A good example of this is if you've been diagnosed with an earlier stage breast cancer or lung cancer or colorectal cancer, and you're currently in the surveillance period where you're not actively treating cancer, would strongly consider postponing visits until the summer, and that's if at all possible. If you're asking me if there's a big difference in the surveillance period between getting a scan now versus 1 month or 6 weeks later, there really isn't any downside to that. And certainly the more we can prevent exposing our other patients and our staff to COVID-19, the better. We should also consider virtual health visits. Medicare and insurance companies have really stepped up to cover this service, and so many practices are now transitioning to allowing virtual health visits, which is a nice option in terms of reducing risk. There's no specific evidence or guidance on the use of masks in patients with cancer. And so obviously, if you're sick, the CDC general guidelines recommends using a mask. But if you're asking if you have a diagnosis of cancer, but you're not feeling sick, there's no real evidence on the helpfulness of masks in that setting. So do not feel like you absolutely have to go out with a mask just to take a walk. Keep in mind that not all patients with cancer are severely immunocompromised. And so a good example of that is if you've completed your therapy for breast cancer, colorectal cancer, or other cancers, and you don't have any you're not currently in treatment, your immune system is not necessarily immunocompromised in any way. And so certainly don't feel like just because you've been previously diagnosed with cancer that you're in an immunocompromised state. I'll also mention that most healthcare institutions are right now postponing elective or non-critical procedures. And so certainly understand that if you're scheduled for an elective surgery or procedure, or a non-urgent CT or MRI scan, that this may be delayed or postponed, and we ask for your grace and understanding when it comes to this. How that might impact patients that are diagnosed with cancer is that if you have a procedure such as a screening colonoscopy or a diagnostic mammography, that might be delayed. And in this case, I think the benefits of delaying really outweigh the risk of not having that procedure done this month. What about clinical trials? Many of the patients that are on this call may be participating in a clinical trial. I will tell you that for patients currently enrolled in clinical trials, they'll most likely continue as planned, particularly if you're receiving treatment on a clinical trial. There are some observational or prevention clinical trials where things may be delayed. I will just tell you a word of caution that patients seeking to enroll under clinical trials may experience some delays in clinical trial enrollment. depending on the clinical situation. And that is, I think right now, most institutions are proceeding very slowly with clinical trial enrollment, but if this crisis gets significantly worse, that might be placed on hold for most of the major institutions in the country. I'll kind of wrap up with a couple of things here. The World Health Organization did come out with a statement on March 11th saying, we cannot say this loudly enough, clearly enough, or often enough. All countries can still change the course of this pandemic, and I think you've seen a lot of action in the United States to really change the course of COVID-19 and really flatten the curve. They mentioned detecting, testing, treating, isolating, tracing, and mobilizing people. And the challenge is not whether we can, but it's whether we will. And so we want to be prepared and ready. We want to detect, protect, and treat our patients. We want to reduce transmission, and certainly we want to innovate and we want to learn. There's been a lot of questions and comments from a lot of different sources looking at treatments. And I'll tell you that right now there is no known treatment other than really good supportive care for COVID-19. This is a list of drugs that are currently under evaluation. There's been a lot to be made of the anti-malarial drug chloroquine and hydroxychloroquine. I will tell you that clinical trials are on the way. There are other antiviral drugs. Remdesivir is a drug to treat Ebola. We're looking at HIV drugs. The one thing that I will tell you is that there is some caution advised with ibuprofen with this disease. There have been some reports suggesting that ibuprofen may actually make things worse. And so right now, I think this is a very evolving and rapidly changing field. And I will tell you that a vaccine is still a long ways out and at least a year away. But we do have some good news. I think that the things that we've implemented in the United States and in Colorado will no question help. We live in the internet age. You're on a Zoom meeting. I think everybody's getting very used to WebEx, Zoom, Skype, and video medicine is going to be increasingly widely available for our patients. You think about how this may have impacted us just 5 or 10 years ago if this virus came about. And this idea that we actually have grocery and medication and food delivery options that really weren't available even just 5 or 10 years ago means that we are better prepared now to deal with this than maybe we ever have in the history of our country. Our institutions and state have taken action early, and so we're working with triage systems to reduce unnecessary exposure to the vulnerable. We're going to continue to ramp up state and institutional testing. We want to reduce financial harm for quarantine and testing, and obviously we've implemented travel restrictions. So that's what I have for everybody on the call. I'll certainly open it up for questions and discussion. I will tell you that Christy Cahill will discuss some COVID-19 support options, but the School of Medicine here, the psychiatry department, has set up a COVID-19 support page. I will tell you that this idea of quarantining and self-isolation, even with your own home, if you're worried that you have COVID-19, and social distancing really is going to have a major impact on people's moods and how they're feeling and how they're doing. And so number one, certainly be aware of that. Number two, we want people to be reaching out. I think the amount of support for not only healthcare providers, but really people across the country, I think I've really been encouraged by. But there are some resources that are available, and this website does provide that. In terms of COVID-19 information, particularly for patients with cancer, the American Cancer Society has a really nice website, and I provided the link here. That's where a lot of this presentation has come from. And so this is continuously updated. It was last updated on Saturday. So check back here if you have for additional information regarding COVID-19. And with that, I'll turn it over back to Andy and Christy, and we'll take some questions.
Awesome. So Chris, I have been getting tons of text messages and emails from people telling me this is right on point. So thank you everyone for joining in. We have almost 65 people on the line. So I'm going to go ahead and jump into some of the questions that are coming in. We've got 4 or 5 already. Right now, and Chris, I think you did a nice job of teeing up that our state has been pretty proactive about the guidance, but I do think Lisa on the line and several others had noticed that yesterday Governor Polis had really taken that next level down, and at the conference call and in the conference had talked even about maybe even restricting the amount of outdoor activity. And I think the question specifically says, I'm scared to even walk my dog after that conference because I am high risk with stage 4 lung cancer. Should I shelter in place and completely avoid going outside, even in my residential neighborhood? And I guess, Chris, that question of if you are immunocompromised, if you are very vulnerable, should you completely shut in? Or is there a healthy balance between going outside and getting some air? What's your feeling, Chris?
Yeah, and Andy, thank you for that question. And the answer is there is a healthy balance. I really want to encourage people not to just lock themselves in their room in complete fear. And so outdoor activities really encompasses a big range of things that you can do. So if you think about walking in an open area where you can safely maintain 6 feet of distance, that's a really great example of something that really is completely safe to do. And the idea being, as long as you're not in a gigantic crowd walking, that's what you want to avoid. A good example of something, an outdoor activity that we don't want people participating in is basketball. In order to play basketball, you have to literally be really right next to somebody, or you're not really playing great defense. That's a great example of something that you can do outdoors that we're encouraging people not to do because it's basically putting people in the same place at the same time. So I definitely want people to be able to get outside. I think the weather this week, for the most part, is going to actually be very, very good. And so if you can maintain distance, I want you to be out and walking around. We'll see in the future if there are even further restrictions on that, but at this time, it's hard to imagine that is, an unsafe thing to do as long as you can maintain appropriate distance.
Right. And Chris, speaking of that appropriate distance, I guess for all of us who are going on walks or hanging out or encountering people on the sidewalks, would you say like it's an arm length away? Like what's just a good sort of indication of what that distance looks like?
Yeah, so it really is 6 feet. There probably isn't really anything special about 6 feet, but if you imagine that if you stick your arm out and the person that's close to you sticks their arm out and you're separate by that length, that's roughly 6 feet. And really what you're giving respiratory droplets a chance to do is hit the ground before hitting something else. In New York City and Chicago and other high population, high density areas, that gets really, really tough. But if you can maintain that distance, which is a lot easier to do in Colorado, that would be the recommendation. Now, some of the questions that come up is, well, what if you're at the grocery store and you're in line? And that's where it gets a lot harder to maintain social distancing. And that is a situation where if it really is going to be impossible for you to maintain 6 feet of distance at like King Soopers or Costco, that might be something particularly for our vulnerable patient population that we would want you to avoid if at all possible.
Great. That's a great, and then I think on this theme, specifically for cancer patients, and then we'll get into a few of the other questions and comments. For patients on immunotherapy, does COVID-19 pose a greater risk for them? Is there enough data to know that these sort of new emerging treatments with checkpoint inhibitors, blockades, and just the whole umbrella of immunotherapy, is that a subpopulation, Chris, that's even more, I guess, immunocompromised of sort?
So a lot of the things that we are basing our decisions about are based off of really, really small data sets. And what I mean by that is in Italy, when we talk about patients with cancer having potentially a higher risk of being hospitalized and having complications, a lot of that was based off of the experience from just 18 patients. And so it's kind of remarkable what we don't know. And so in regards to immunotherapy, the question largely being, so there's a good part and a bad part to this. That's all hypothetical. So the answer is nobody truly knows. But if you're currently receiving immunotherapy, are you immunocompromised? And the answer is no. Unlike chemotherapy, which may reduce white blood cell counts along with other blood counts, immunotherapy should not cause you to be immunosuppressed, because actually what you're trying to do with immunotherapy is actually increase the immune system's response against cancer. So are you more likely to get COVID-19 if you're on immunotherapy? The answer is no. The issue with COVID-19 is the fact that it creates such an inflammatory state. And so that's why you develop fever and you develop cough and you develop shortness of breath, because it creates essentially a viral pneumonia, which is an activation of the immune system. And so hypothetically, are you more prone to developing, worse symptoms with immunotherapy because your immune system is already geared up, and then if you get COVID-19, you can continue to ramp up the immune system? That's a question that nobody knows the answer to. So at this time, the guidance really is, just like it is for anybody else, in the country, because you're not necessarily immunosuppressed. But at this time, we have no data to support that receiving immunotherapy is better or worse in terms of COVID-19 infections.
Right. And I do think that there was a really nice shout out in the chat that was talking about specific times for vulnerable populations to do shopping. So I know Target, a number of the grocery stores and suppliers in a lot of different genres have talked about specific times of day where people who are vulnerable can go to shop. And I think, Chris, your point around how do we keep that distance also in shopping centers, particularly maybe around the toilet paper aisle, is probably a big issue right now. But I do think that that's a really great comment. They'll make some special attempt that if you do go out, you're also thinking about when are there specific opportunities for people. And it sounds like they're not asking a lot of questions and going on the honor system. So let's see, Whole Foods is strict that's 60 plus. It sounds like Safeway might be like Target, where they're offering some leeway. So those are really great comments, and I think encourage people to consider your own circumstance and when you should be shopping or having others support you in that effort. I do want to, it sounds like there's a couple of folks, I know that we started right at 9 a.m. And Chris, early on in the presentation, you shared that, of course, the coronavirus is actually even a derivative in this current state from the common cold and the viral type infections that you would see in the normal flu season. There was a specific question that not meaning from what country, and I think we all know, as we've discussed, China and the Wuhan region being the first where we saw the corona virus. But Chris, can you just say a little bit more going back to that, and then that origin piece and how we think that this virus has evolved to be something that's more virulent and probably severe than the cold virus? Can you just say a few more words? I think a couple people missed the beginning of the presentation.
Sure. I think we'll learn more as epidemiologists are able to dig down into what exactly happened. A lot of this links back to a seafood market in Wuhan, China. But I think what's also very interesting about this is that the first patient that was ever diagnosed in China didn't even have exposure to that seafood market. So there are a lot of questions here that we don't really know the answer to. A lot of the assumption is that this was initially an infection that passed through animals. And so there's been some hypotheses as to whether it was, what type of animal it was. But the simple answer is that sometimes these diseases can really originate in an animal population and then essentially be transferred through different means to infect one person. But then when that person gets sick and starts spreading the illness, many times this happens when somebody's completely asymptomatic, where they're not having any signs or symptoms of being sick at all. And then from there, the disease kind of exponentially grows. But a lot of people believe that this essentially started as an animal infection passed on to humans through essentially a seafood market in Wuhan. But right now, it's probably more speculation than it is anything else. But that was certainly the epicenter of the outbreak. But in this day and age where people are literally just traveling from country to country, it's not hard to understand how quickly this spread, not only in the Asia region, but then obviously to Europe and then finally hitting the United States as well. But the other thing is when you look at the Johns Hopkins map, I mean, every continent with the exception of Antarctica has been hit by this virus at this time.
Great. Thank you for sharing that. A quick question, Chris, and I don't know if you've mentioned this in the presentation, I can't remember, but just to reiterate, if someone has not had a flu shot this season, is there any benefit at this point of having a flu shot?
Yeah, so it's pretty remarkable that to this point, 29 people have been diagnosed with the flu in the United States alone. This is usually around the time that the flu season really does start to die down. Having said that, it really isn't ever too late to get a flu shot. I think this year the flu shot was actually much more effective than it has been in previous years, which means the guessing that they did a year ago before they started creating the vaccine was actually quite good, maybe even comparison to other years as well. It's not too late to receive the flu shot. I would say the risk of the flu is certainly decreasing, and it will decrease pretty rapidly over the course of April and May. But the answer is it's never too late to get a flu shot.
Okay, great. So the other thing that has come up here, and I think this is a really interesting question, is I think that the public is being asked to help in a variety of ways. This is an interesting question. It says, what is the guidance for those who want to help by sewing PPE for healthcare workers? Who's providing proper sewing requirements for these items and encouraged? Where do people take items? What health programs or institutions are accepting these type of donations? And so, Chris, I don't know if you or anyone specific on the call, but it sounds like we have somebody who has some great talents that they're going to put to use. Any idea about, I guess, what constitutes and what, if you can explain what people are using as, I guess it's personal protective gear of sort, and then if there are any specific things that you know about donations or even for this specific question?
Yeah, so this is definitely something that's in flux. I can answer for our institution that right now we are not accepting these donations at this time, but that's also something that we discussed on a call this morning, and I suspect that will change in time. I will tell you that this is really indicative of how awesome our community is. Our community is absolutely incredible. And I've really seen the best come out of people during this time, which is really, really inspiring, and certainly inspiring to all of us, the healthcare providers in the state of Colorado as well. I will tell you that for personal protective equipment, what people are describing when they talk about that are N95 masks, which are masks that prevent respiratory droplets from kind of hitting somebody's nose and mouth. But this also includes these masks with face shields, the gowns, and the gloves that people are wearing. At University of Colorado, what we're doing is a lot of times when people don this personal protective equipment, they'll throw it away. But here, you're going to see our hospital, along with many other hospitals, start to reuse personal protective equipment. And what this means is essentially to return it, get it sterilized and cleaned, and then back into the system. And there's no shortage of PPE at the University of Colorado right now, but I think it's not what's happening right now that concerns us. What could happen in the future. So number one, with that volunteer spirit, please never lose that, and we're going to definitely need it in the coming weeks. Number two, in terms of volunteer and donations, we're holding on that until we can kind of put a policy into place, but I expect that to happen in the next 24 to 48 hours.
Okay, great. And I think that it seems like several folks, Becky Seelig had noted that many businesses and private individuals are making specific spots where you can donate supplies, and they'll share information on those website links that are linked about what's needed, where to do drop off, what are the requirements, and then it looks as if, let's see, Debbie, I believe, and other folks have talked about how they're helping support Denver Health, or I think Katie, no, Katie, oh yeah, sorry, it was Katie, that's in touch with Denver Health and others about how to make these sort of donations. So the links are provided in the chat. We'll make sure to follow up with those as well. And I do think, Chris, like you're saying, the folks who are talking about these sort of donations and encouragement, it's great. Chris, I know before we started talking today, we talked about probably the criticalness of the next 1 and 2 weeks. And I guess if we had to say what's crucial, and I think you noted this about this again in Italy in terms of what the wave and what we're seeing right now, but to reiterate, I think that whole idea of the sort of what this couple weeks will really show for us. Can you reiterate that one more time about what we think we'll see and how that will help us maybe project the future?
Absolutely. And I think that there are two things that we're going to have to really focus on. Number one is the number of confirmed cases, which has to be much, much higher than what is being reported right now because we're simply not testing. And so it's really hard to know what the hospitalization rate of a disease is if we don't really know what the denominator is. So, right? So like if we say that, well, this many percent of patients are expected to be hospitalized, it's hard to know what that number is if we don't know actually how many people actually have the disease. I think that the reason why there's a lot of concern over the next 1 to 2 weeks is because if you look at what's been going on in Italy, we're tracking about 1 to 2 weeks behind them. And so we will not be able to necessarily see this in terms of a spike in cases, but we'll probably see it in terms of hospitalizations and unfortunately people who have contracted COVID-19 and have passed away from it. And so I think that over the next 1 to 2 weeks, the numbers that we'll really be needing to track are really the number of hospitalized patients. Because those are the patients that we are testing, which will obviously, be seen in the number of cases that we're seeing. But the next 1 to 2 weeks will be very telling in terms of how much we're stressing our healthcare system. I will tell you right now, and that can reassure you that, we are ready. And there are literally meetings that are happening around the clock to prepare the hospital, and the hospital systems, to my knowledge, are not overtaxed at this time. But that's what we're going to be really monitoring. And my hope is that everything that we've implemented, particularly in the state of Colorado, is really what's going to help flatten that curve and help us be able to treat and care for our patients. But I kind of liken it to we're just kind of, we're prepared and we're ready, but we just kind of have to see if this wave is going to come or not. And my hope is that the things that we've implemented will help that wave to be more of a ripple as opposed to a tsunami.
Great. So Chris, and I just want to encourage everyone, I think Peg might have a question that I don't know that it's come in, or Christy or Becky or others, if there are questions that have come in that I haven't seen, please put those on the radar. I'm going to scroll down here too. Let me see if there's one more that came in. Chris, the CDC put out a report a couple of weeks ago, or actually a couple of weeks ago, it was I think last week, that showed the mortality rates, I think, in different age groups. And of course, we've heard about the elderly, particularly being vulnerable, but we also saw a bit of a peak in people who were in their 20s, maybe late to mid 20s to early 30s. Is there any sort of feeling about, is that an exposure type of situation, or is that more about something that's interesting about how the disease is really impacting certain age groups?
Yeah, and it's funny, Dr. Fauci, who's, been leading the task force on COVID-19, and you've seen him a lot on television, really did kind of speak to this. There is a group somewhere between like 20 and 40 where there are a decent amount of hospitalizations. And luckily, we haven't seen a lot of deaths in this group. But the question largely being, is there something that younger people that makes them, potentially a little bit more susceptible to the respiratory pneumonia that people are seeing? I would say that it's something that we've seen. It is a little bit of a caution to everybody who's young out there that just because the death rate in the younger population is lower than the older population doesn't mean that you're, kind of invincible from COVID-19 either. And I think that that's one of the big public service announcements that, that really kind of needs to be out there, is that there is a certain amount of hospitalization rate, which means that people are very, very sick in that age group. Now, the question largely being, is it because they have a robust immune response and that's why they're developing these kind of big pneumonias where it becomes hard to breathe? That's something that I think we'll know, or we'll learn much more in the next couple of months. But this also is a kind of a nice segue to also tell you that the research regarding COVID-19 is exploding in terms of people not only looking at the disease itself, and learning more about it, but also in terms of treatment. And you're starting to see clinical trials up and running already in regards to looking at some of the drugs that I showed you. I will kind of also make just another public service announcement of, please do not take these medications like chloroquine, outside of the context of a clinical trial. And there's no evidence to support its use either in the treatment or the prevention of COVID-19. So I want to reassure people, don't take these medicines. We don't know if they help or hurt or what. So, unless in the context of a clinical trial, please don't try any of those medications.
Okay, great. And I want to do a shout out because I know Christy and others are going to share about resources momentarily. The question about also the COVID-19 statewide support line, Becky did a nice shout out, and just a reminder to folks that there's a website that can probably answer a number of your questions. I know that call line is taxed right now. And then ultimately, if it's about medical advice or medical decisions, they are not permitted to share one-on-one individual medical decision making or the like. They can give general information, but that needs to then, those specific medical questions need to be placed with your medical provider and team. So just as a quick reminder, and I think Christy will talk about that line. Folks have questions about that line and resources and what it does and doesn't do, but I think Becky does a nice shout out noting that there's a lot of support even on the webpage. So I know they're manning that line and doing the best they can to keep it capacity right now. So just a shout out to that resource, but just making sure that we have the right orientation. And then I guess, Chris, back to you, and I know you did a nice job of talking about there are elective procedures that can be rescheduled. So you're definitely like just a average risk population screening. Some of the times where we can look at maybe foregoing treatment or looking at what treatment, not foregoing, but looking at what that schedule might look like based on the risk and the benefit. But there is a question that says, and I know Chris, you said currently the Colorado hospitals at large seem to be able to meet the demand, but did you see a risk for patients who are getting cancer treatment at Anschutz or others locations that they might not have access to the cancer treatment in the future? What is, I guess, to that look like if you had a sort of a bit of a projection? What do you think, Chris?
Yeah, so it's a great question, and it's definitely something that we've talked about in all of our meetings. I would just say, if right now, in terms, I think the key here is to understand that the supply line, as it comes to food and medications, that's currently operating, I would say, remarkably well. And so if you're asking if I'm worried about drug shortages in the short term, I am not. Now, the things that could change that is if they ground, for instance, or if they just stop all transportation. And I find that very, very difficult to believe that they would halt the supply lines for food and medication. That's the one instance where we would start thinking about not having enough drug to treat our patients. But at this time, I really do. It's a fantastic question. It's definitely something that we are prepared for. But having said that, no, there's no disruption in the supply line for medications, and therefore we have not had to worry about rationing drugs, for instance. Now, the key here is also to be able to provide medications, particularly IV medications, to our patients, which is completely contingent on staff. And so therefore, when you hear people talk about preventing visitors from entering the hospital, from delaying appointments or going to virtual health appointments, when you talk about delaying procedures like screening colonoscopies or mammographies, or even CT scans or MRIs if they're not urgent, this is the reason why, is because it's not only to protect our patients, but to really protect our staff as well. And so, certainly appreciate everybody's understanding and patience when it comes to that.
Great. We're going to go with this final question, and then I'm going to turn it over to Christy to talk further about our resources. And just as a reminder, there's some great conversation in the chat with those links that will be available. I did receive a couple questions asking if we were going to have access to this webinar for distribution for others to either rewatch or share. The answer is yes, and Christy will share a little bit more about that as well. And I think that this will be housed on the coalition website, but Christy can share that detail and others as we jump into the resources with and then we'll have our final question, and then we'll kick it back to Christy. So there are 2 pneumonia immunizations recommended for older folks, thought to be helpful against the resulting pneumonia. And does this make, particularly, Chris, I think part of the question and comment is, will this help particularly with that connection of the type of pneumonia that might be linked to COVID-19?
Yeah, so great question. The answer for vaccinations is always yes, if it's age appropriate. There are certainly vaccines for pneumonia, the Pneumovax, the shingles vaccine, among others. But and specifically to COVID-19, these vaccines will not impact anything in regards to COVID-19 infection or potentially even mitigating the infection itself. And so the answer is always get the vaccines that are certainly age appropriate for you. But in terms of protection against COVID-19, because those vaccines are really designed for other specific viruses or bacteria, it's not going to be very helpful for this particular version of coronavirus. And so therefore, will there be a coronavirus vaccine in the future? I'm obviously very, very hopeful that there will be, but it's going to be a long ways out.
Very, very good. Chris, one final comment. There was a question about SARS and the connection with the common cold and coronavirus. They're all within the same family. Is that correct?
Correct, and this would be kind of a version of that, but obviously distinct entities, but in the same family.
Okay, very good. All right, well, a huge thanks to Chris Liu for all of his support. I know that we're on in April again. Chris, I think suffice to say, if there is another turn of events or an order of magnitude of something that's different that comes out and particularly has implications for cancer patients, we bring back in your expertise as well as those from out the healthcare community to provide everyone great updates. So I really want to say thank you for being so responsive. I think we asked you on Friday to come in because it was becoming very urgent, and you did it. I think responded you were on break and did this first thing on Monday morning. So I think a huge commitment. It shows the commitment of you and many of the team members, and huge thanks to everyone who's doing all that they can on the front lines and then supporting. It's been great. So Christy, I will kick it over to you. Chris, any final last words before we have Christy talk resources?
No, thank you for taking the time to join. Our community has been absolutely amazing, and so for everybody out there, thank you for volunteering your time and your efforts, and for your words of support. And keep supporting each other. Stay healthy. Follow the CDC guidelines, and stay safe, everybody. Thank you for taking the time.
Great, Christy.
Thank you. All right, I'm just gonna pull up the coalition's website actually instead of the PowerPoint so I can show you directly. If you go to the to coloradocancercoalition.org and go to For Patients and Survivors, there is a tab called COVID-19 and Cancer Patients. And so, the helpline is listed there. The helpline is there. They are recommending that you look at the website first before calling to see if your general questions are answered, and then you can give them a call if not. And like Andy said, they can't provide medical advice or where you can get tested, but they can provide other general information. The recording for today's webinar will be right here. And then we've provided some hospital partners have collected anxiety and mindfulness resources. There's a coping with stress during an infectious disease outbreak. There's an English version and a Spanish version. And if you scroll down, we have some of the other resources. The American Cancer Society one that Dr. Liu mentioned was right here. So these are all geared specifically for cancer patients. Then UC Health has moved all of their support groups to virtual, so you can call to get more information for those and to register. And then we have a few disease-specific resources as well, and we'll be continuing to build this out as more information is given to us. So if you have credible evidence-based resources that you have found helpful, please send them our way. to info@coloradocancercoalition.org. But we are continually updating this page so that you can come here and find the information that you need to help cancer patients and help your constituents. So thank you to everyone who has sent information, and thank you to everyone for joining today. Thank you, Andy, for moderating. I guess the last thing I just want to mention is we have been, Chris mentioned Zoom and how you can connect on that. So being socially distant doesn't mean you have to be isolated. So make sure that you're finding ways to connect through FaceTime, Zoom, group chats, and things like that, so that you can really connect with your friends and family and still be there for each other. Andy, do you have anything else to add?
No, just a huge thank you to Christy for all the support that she's put in for the coalition and making sure that these sort of webinars come to life. And again, thanks to Elsa Waltzing for her sort of support on the back end. Thank you. Thanks again, Chris.
Yeah, thank you, everyone. Go be safe. Alrighty, bye, everyone.
Thank you.
Bye. Thank you. You guys are amazing.